Well, welcome back. In today's Health Yes with Genesee Health Plan, we're talking about Minority Health Month. So joining me now, Sharonda Grigsby, Program Officer for the State of Michigan Office of Minority Health, and Yvonne Lewis, Director of Outreach for Genesee Health Plan. Thanks to both of you for being here. I want to get to our first question. First of all, what is minority health? What do people need to know about this?
Well, minority health is a persistent effort to focus on those disproportionate health outcomes faced by Michigan's racial ethnic minority populations. Minority populations typically see health outcomes that are significantly higher than those of the general public, and those health outcomes tend to be around cancer, diabetes, heart disease, infant mortality. So it's important that we keep a persistent focus on kind of addressing and monitoring those health disparities so we can make sure that we kind of eliminate some of those disparities that are happening in those populations.
So when is Minority Health Month observed?
So it is actually April.
Okay.
It starts the full month of April. And again, as I say, with focusing on why these differences happen. And the thing is about minority health, sometimes we look at it only from an ethnic perspective, and that is true. But we also have populations within those segments within the populations that also suffer disproportionate or more poor health outcomes than other groups.
Okay. Now, what does Genesee Health Plan do to raise awareness for minority health?
Well, we're talking about this all the time, actually all year, but we really focus our attention in the month of April on really helping to inform the community that we have an Office of Minority Health in our state, and that it's important for us to address this issue. So we have a multicultural system of care that we're consistently working on, and all the events that we're going to this month, we're really trying to say, let's elevate this, let's really talk about this issue so that we can make a difference.
Yes. Now, how does Genesee Health Plan really assist the state in promoting this? Like you said, there's events and things like that, right?
There's events, but we also have a partnership, and we were funded by the state to develop what we call our multi-sector team. Okay. And this multi-sector team brings organizations together to specifically focus in on what are those issues, the real issues that cause or create or continue to have the disparities exist. So when we talk about transportation, what is it that we really need to do to address that? Translation and language and cultural barriers. How are we really paying attention and focusing in on those issues as a collective community to ensure that we reduce those barriers and improve the overall quality of health?
Right, that's a big job.
It is a big job.
Genesee Health Plan, are they doing anything else this month to promote?
Yes, actually on the 25th, we'll have a Facebook Live event located right in our office at 2171 South Linden Road in Flint. We'll have, again, Sharonda will be there along with the manager, Cheryl Weir, from the State Health Department. We'll have local representatives there. We'll actually be having a real conversation about calling us to action. We know these disparities exist, but what can we do individually? What can we do collectively and as a community to make sure that we know what the disparities are or the differences in health outcomes are and what we can do to improve our overall health outcomes.
Wonderful. Thank you both for being here. And we are not going to wrap up quite just yet with these ladies. After the show, we're going to have a Facebook talk back. If you have any more questions, right after the 9 o'clock show ends here on our TV5 homepage, Facebook page that is, you can log on there and we will talk more about this topic. And that again is on the TV5 Facebook page right after the news at 9. We'll be answering your questions live.